Hello, today we're going to speak about the new innovative ESP Stat-A-Dyne range of motion product. ESP actually stands for elbow supination pronation. This product is unlike anything else that's been entered into the industry in the orthopedics realm because it's a device that we can actually address four motions on the upper extremity at once. So there are some unique advantages of having a device that address supination pronation as well as elbow flexion extension. What we're going to do is we're going to start distal on the device and work our way back proximally. First thing to take note is this is a Stat-A-Dyne product, so this hinge allows me to do both static progressive stretch as well as dynamic low load prolonged stretch. So if your patient responds better to SPS or LLPS, you have that option as a therapist. You're not pigeonholed to choose one type of modality. While we're on that subject, if we move more proximal, the elbow hinge is also a Stat-A-Dyne hinge, and it gives you that same features, advantages, and benefits. Moving a little bit more proximal on the device from the very distal end, this device has what we call a radially based cuff. Where other supinator pronator devices in the marketplace have a cuff that mounts ulnarly on the forearm, this radially based cuff actually mounts on the radial side. The drive mechanism of the actual device is also on the radial side of the arm. And so what this offers is it offers a correct anatomical rotation of the forearm, because the actual drive mechanism is on the bone that rotates in the arm, and it's not on the ulna bone, which is a stationary bone. If we look at the actual cuff itself, we have what is called a 3/4 cuff, not only circumferentially but also longitudinally. So this will control the radius well while avoiding carpal torsion. So after a distal radius fracture or other procedure on the wrist where you want to make sure that you're rotating the radial head proximally, will actually control the motion distally and make sure the forces are applied where appropriate. Moving our way back, we have an elbow flexion extension hinge. And so the device actually will go into 45 degrees of hyperextension, not because anatomically your elbow can do that, but what we have noticed when designing products is that there are a lot of braces in the industry that will say they're at 0, but because of soft tissue give, the elbow may have, let's say, 20 degrees of flexion still in it. So if you have a brace that can hyperextend, it will compensate for any type of soft tissue give. The device is also capable of 140 degrees of flexion because our distal cuff can actually fit inside the proximal cuff during elbow flexion simply by loosening these two straps. But let's speak a little bit about some of the clinical advantages and benefits of having a two-joint product for elbow supination pronation and elbow flexion extension. The advantages would be this: if we take into consideration a patient who's had a distal humerus fracture, the sequelae can be a multitude of things. And so if we think about a patient getting an elbow device and a supinator device, we will immediately cut their wear time in half with an ESP, because we can address elbow extension with supination or elbow flexion with pronation. The other thing that we can also keep in mind is that we are going to help control the patient's out-of-pocket cost, because instead of paying for two devices, an elbow flexion extension and a forearm supination pronation, they're going to get both of those modalities in one ESP. So when you are examining your caseload or the population that you're working with, the key thing would be to examine patients with stiff elbows who might also be lacking 10 or 15 degrees of supination and pronation, and they may be a very appropriate candidate for the ESP. When we also consider collateral repairs of the elbow, if we talk about the medial collateral, or UCL as it's also known, we can protect that repair with the forearm rotation of the device. So we are going to use a mnemonic, MS, for medial collateral repair. if you have a medial collateral repair or UCL repair, you're going to want your hand in supination to keep that ligament on slack during elbow flexion and extension. And if we have a lateral collateral repair, we're going to use the mnemonic LP. And so you're going to want to have your hand in pronation during a lateral collateral repair. So perhaps after a collateral repair, you'll be able to start range of motion earlier than you typically would by positioning the forearm into pronation or supination. If you want to lock the forearm in pronation and supination and not allow the patient to be able to rotate this knob, we can actually zip tie the rotatory mechanism of the brace to the actual frame of the product. When we think about other clinical situations, let's take distal biceps rupture, for example, into consideration. We will see patients who literally will be able to extend their elbow to 0 when their thumb is in neutral. But once that patient rotates their forearm into supination and then they try to extend their elbow, they may be lacking 15 or 20 degrees of extension. The reason for this is because the bicep muscle has shortened. And so one of the advantages of the ESP device is we can actually rotate the distal forearm in full supination, and then we can extend the elbow in full extension, and therefore isolating that tight soft tissue that may not be able to be addressed with other products in the marketplace. This is a good example of what we call combined motion therapy for the ESP. Those are some of the highlights on the ESP device manufactured by Lance Medical. We truly feel like this product is an innovative device that's going to help clinicians treat patients unlike any other product in the industry. And we appreciate your time viewing this video.